The quality of work is best done by full-time permanent staff, and we'll always say that. But we certainly can deliver a quality product in the absence of social workers. I came out of agency practice with an idea of starting this business, not only because it was needed, but also because we felt that it would be a resource for agencies, but also for social workers. So I thought about, well, nursing has Nursing Float. Why wouldn't that work for social work?
One of the great pieces of working with Social Work p.r.n. and having connected with Social Work p.r.n. is the founder, Joan Upshaw. You know, what do I say about her? She's an incredible woman, the quintessential social worker is what we call her.
So we're interested in this, not only the profession now, but the profession for 10 and 20 years from now. What are we going to have to be teaching? What are we going to have to be educating? Where are we going to have to be helping people to get to?
Promoting social work as a profession is one of the nicest things about Social Work p.r.n.
Yeah.
I find that very, very refreshing.
Having an agency like Social Work p.r.n. that provides an avenue for temporary social work staffing, I actually think is an asset to the profession.
Social Work p.r.n. provides several different products. The core product is staffing services.
Temporary staffing, temporary to permanent staffing, and permanent placement.
We also provide consultation services, continuing education, and supervision.
Another service that Social Work p.r.n. can provide is speakers for in-service training and workshops.
Now, our fees differ across the country because social work salaries differ across the country. We'll look to see what are social workers making when they work in a hospital setting, what are social workers making in EAP and managed care practice, what are social workers making when they work in long-term care or in children and family services, and then we set those fees accordingly.
They have a very good understanding of the social services providers out there, whether they're community-based, hospital-based, mental health center-based.
We've served nursing homes and hospitals, day treatment programs, residential treatment programs.
Health centers, prisons, local comprehensive mental health centers, protective services,
Chemical dependency. I had a request for a private adoption study.
We tend to call on Social Work p.r.n. when we have staff vacancies. We have about 18 social workers in various positions, from medical social workers, mental health case managers, HIV case managers, counseling and testing. As we're kind of developing programs and trying to get to a point where we're going to hire the right candidate, I have found Social Work p.r.n. to be very useful in coming in and helping even in that phase of the development.
Because to my knowledge, there was not a social work temp agency anywhere in the city, and I was very aware that my colleagues in nursing and in the therapies, if they had a sudden loss of a staff member, would just sort of cavalierly say, oh, we'll call an agency, and I just never had that advantage before.
Usually to get somebody out from Social Work p.r.n. to help us is usually pretty immediate. I mean, I think at most I've only ever waited a week.
When I'm hiring a social worker, I look for a variety of different things. I look for a social worker that's very diverse in their background, their experience, and their skill levels. I look for a social worker who's really interested in our model in terms of us making good fits.
I know that you know that at least 3 of the 4 I hired full-time, and those 3 were really and continue to be very, very excellent employees.
Our agency uses both MSW and BSW level social workers.
It not only provides you that temporary staffing need, but if it becomes a long-term staffing need, you've basically auditioned the person already and you don't really have to do much work after that.
When a customer calls for placement of a social worker, one of the benefits that they receive through us is that we have provided all the things that they would have to do. We have already screened them, we've already interviewed them, we've checked their references, we've checked their credentials, and they are prepared to start work day one.
Well, I think the great thing about Social Work p.r.n. was that it was an affordable option when we needed a temporary person to come in. The thing is, it's a doable option. You know it's there, so you don't have to worry. When you know you're going to have short staffing, you just call them and it's like, you know, it's done, it's taken care of.
I really feel like social work p.r.n. really invests time up front in training and really mentoring emerging new social workers, and actually ones that have also been in the field a long time.
Career-wise, it has allowed me to experience lots of different things.
I was able to go to different settings, learn about them, and enhance my clinical practice.
I wanted to have a very broad range of social work, and I think working with social work p.r.n. offered me that opportunity.
There's definitely an increased need for temporary staffing just because of different needs of the workforce.
The coordinator and other staff at social work p.r.n. have really spent time learning my agency that I work for too, which I think is really important. So they know my setting, they know what the environment is like, they know what the expectations are. The process that we usually go through to bring in social work p.r.n. is I usually contact the coordinator at social work p.r.n. and let them know of, here's what I've got open right now, this is the type of person that I need and the job I need them to do. And I think that's what's really been good about the social work p.r.n. management is that they really know, their p.r.n. staff, they know their skills, they know what would be a good fit within my setting.
We have a concept of building a core staff, and so we have persons that would be available to serve when settings have a need. And we look for persons with a wide variety of experience, persons with experience in healthcare, mental health, children and family services, and for persons who can work in what are normal settings generally ask for persons 20 to 40 hours a week.
They're always very professional and very independent. Without exception, I can just send them up to the floors with just a minimal amount of orientation, and they can just jump right in.
The thing that most impressed me is that they are quick learners, they are well trained, they're very professional, high standards of social work ethics and values.
Well, I think social workers in today's work world are attracted to social work p.r.n. Because of their ability to keep their autonomy and to make decisions for themselves when they want to work, when they don't want to work. Our interest in their growth and development. They have our respect. They have our cheerleading. They have our affiliation.
Social work p.r.n. was very supportive of me. I only had one assignment with social work p.r.n. And that assignment ended up being a permanent position for me.
We work on a fit model, and we want to make sure that on the upfront that the worker is comfortable in both the environment and with the work, and that the supervisor is happy with the quality of the social worker that we've delivered to them.
And so for us, when we're working with settings and they're describing what they need in a social worker, we understand that.
We maintain contact with the community settings by visiting them, by talking to them on the phone, by being members of associations and being active on committees.
We ask the settings, is there something we need to do or to help the worker do to tweak the fit?
But the coordinator always follows up with me, immediately after, a week of placement to see how things are going, to really assess the skills of the person they've placed.
If we place somebody in a setting and it's not a good fit, it's really as simple as the customer giving us a call and telling us that this person is not making a good fit. They can at that time decide whether or not they want us to end that contract or if it's something that they would like us to support them greater in.
Our primary interest is getting a good fit for both the social worker and for the setting.
We really have a relationship that we develop and we form and we maintain with our social workers. So there's often times for them to come back together, to meet, to greet, to network.
Thanks needs to go to the settings that have trusted us to come into their settings and to keep their confidences and to keep their clients' confidences about what goes on in a setting.